What is the formula to calculate the volume of liquid medication to administer, based on the dose ordered and the concentration available? A. Dose ordered divided by concentration. B. Concentration divided by dose ordered. C. Dose ordered multiplied by concentration. D. Concentration multiplied by dose ordered. The correct answer is C. The formula is dose ordered times concentration. A patient needs 250 milligrams of medication. The vial has 500 milligrams in 2 milliliters. How many milliliters should be given? A. 1 milliliter. B. 1.5 milliliters. C. 2 milliliters. D. 2.5 milliliters. The correct answer is A. 250 milligrams per 500 milligrams times 2 milliliters equals 1 milliliter. How many milliliters are in 1 fluid ounce? A. 10 milliliters. B. 15 milliliters. C. 20 milliliters. D. 30 milliliters. The correct answer is D. 1 fluid ounce is equal to approximately 30 milliliters. What's the formula for calculating IV infusion flow rate in milliliters? We need the volume to be infused and the infusion time in hours. Option A. Volume divided by infusion time. Option B. Infusion time divided by volume. Option C. Volume multiplied by infusion time. Option D. Infusion time multiplied by volume. The correct answer is A. The formula is volume to be infused divided by infusion time. A medication order reads 50 milligrams. The patient weighs 70 kilograms. How many milligrams should be administered in a day? A. 3,500 milligrams. B. 2,000 milligrams. C. 5,000 milligrams. D. 4,500 milligrams. The correct answer is A. 50 milligrams times 70 kilograms equals 3,500 milligrams. How many tablets are needed to fill a prescription for 21 days if the directions are to take 2 tablets 4 times a day? A. 168 tablets. B. 84 tablets. C. 42 tablets. D. 28 tablets. The correct answer is A. 2 tablets, 4 times a day, for 21 days equals 168 tablets. A patient's fluid intake is 1750 milliliters, and their urine output is 800 milliliters. What's their total fluid balance for the day? A. 950 milliliters deficit. B. 950 milliliters excess. C. 950 milliliters balance. D. 1550 milliliters balance. The correct answer is A. Total fluid balance equals fluid intake minus urine output. That's 1750 milliliters minus 800 milliliters, which equals a 950 milliliter deficit. Convert 0.5 grams to milligrams. A. 500 milligrams. B. 50 milligrams. C. 5 milligrams. D. 0.05 milligrams. The correct answer is A. 500 milligrams. A patient is prescribed a 0.25% topical cream in a 60-gram tube. How many grams of the active ingredient are in the cream? A. 0.03 grams. B. 0.15 grams. C. 0.25 grams. D. 0.30 grams. The correct answer is B. 0.25% times 60 grams equals 0.15 grams of the active ingredient. A doctor orders 300 milligrams of medication. The vial contains 600 milligrams per 2 milliliters. How many milliliters should be administered? A. 0.5 milliliters. B. 1 milliliter. C. 1.5 milliliters. D. 2 milliliters. The correct answer is B. If 600 milligrams are contained in 2 milliliters, then 300 milligrams will be in 1 milliliter. Therefore, 1 milliliter should be administered. How many milliliters are in 1 teaspoon? A. 2.5 milliliters. B. 3.5 milliliters. C. 4.5 milliliters. D. 5 milliliters. The correct answer is D. 1 teaspoon is equivalent to 5 milliliters. A patient needs 45 milligrams of medication. The vial contains 15 milligrams per milliliter. How many milliliters should be administered? A. 1.5 milliliters. B. 2.5 milliliters. C. 3 milliliters. D. 4 milliliters. The correct answer is B. For 45 milligrams, 3 milliliters would be needed. This is based on a concentration of 15 milligrams per milliliter. What's the formula for total IV fluid volume if the flow rate is 50 milliliters for 6 hours? Total volume equals flow rate times infusion time. Total volume equals flow rate divided by infusion time. Total volume equals flow rate plus infusion time. Total volume equals flow rate minus infusion time. The correct answer is A. The formula is total volume equals flow rate times infusion time. A medication order says to give 0.1 milligrams of a drug of body weight. How many milligrams should a 50 kilogram patient receive? A. 2 milligrams. B. 5 milligrams. C. 10 milligrams. D. 25 milligrams. The correct answer is B. For a 50 kilogram patient, 0.1 milligram would be 5 milligrams. A prescription calls for a medication dose of 0.025 milligrams for a 60 kilogram patient. How many micrograms should be administered in a day? A. 1.5 micrograms. B. 25 micrograms. C. 50 micrograms. D. 150 micrograms. The correct answer is C. The total dose for a 60 kilogram patient would be 60 kilograms times 0.025 milligrams equals 1.5 milligrams. That's equivalent to 1500 micrograms. How many milliliters are in 1 gram? A. 0.5 milliliters. B. 1 milliliter. C. 2 milliliters. D. 4 milliliters. The correct answer is A. 1 gram is equivalent to 3.7 milliliters, which is nearly 4 milliliters. So, 1 gram is close to 0.5 milliliters. A 500 milligram tablet contains 250 milligrams of the active ingredient. What percentage of the tablet is the active ingredient? A. 25%. B. 40%. C. 50%. D. 60%. The correct answer is C. The percentage of active ingredient is calculated as the mass of the active ingredient divided by the mass of the tablet, multiplied by 100. This is 250 milligrams divided by 500 milligrams, multiplied by 100, which equals 50%. What's the formula to calculate the number of doses to dispense, given the total quantity and the dose size? A. Total quantity divided by dose ordered. B. Dose ordered divided by total quantity. C. Total quantity multiplied by dose ordered. D. Dose ordered minus total quantity. The correct answer is A. Less than break time equals 1s greater than. To calculate the number of doses, divide the total quantity by the dose ordered. A patient needs 150 micrograms of medicine. The vial has 0.3 milligrams per 0.3 milliliters. How many milliliters should be given? A. 0.15 milliliters. B. 0.3 milliliters. C. 0.45 milliliters. D. 0.6 milliliters. The correct answer is B. Less than break time equals 1s greater than. To calculate the milliliters to be administered, convert the prescribed dose to milligrams, then calculate the corresponding volume. How many milliliters are in 1 tablespoon? A. 15 milliliters. B. 10 milliliters. C. 15 milliliters. D. 20 milliliters. The correct answer is C. There are 15 milliliters in 1 tablespoon. What is the correct formula to calculate the solute to solvent ratio for preparing a dilution? A. Solute divided by the sum of solute and solvent. B. Solvent divided by the sum of solute and solvent. C. Solute divided by solvent. D. Solvent divided by solute. The correct answer is A. The correct formula for dilution ratio is the solute amount divided by the total solution volume. A patient needs 75 milligrams of medication. The vial contains 50 milligrams per milliliter. How many milliliters should be administered? A. 1.25 milliliters. B. 1.5 milliliters. C. 1.75 milliliters. D. 2 milliliters. The correct answer is B. Less than break time equals 1s greater than. To find the volume to administer, divide the required dose by the medication concentration. How many milliliters are in 1 cup? A. 120 milliliters. B. 150 milliliters. C. 180 milliliters. D. 240 milliliters. The correct answer is D. There are 240 milliliters in 1 cup. A patient needs 80 milligrams of medication. The vial contains 40 milligrams per 2 milliliters. How many milliliters should be administered? A. 1.5 milliliters. B. 2 milliliters. C. 2.5 milliliters. D. 3 milliliters. The correct answer is A. Less than break time equals 1s greater than. To determine the volume to administer, divide the required dose by the medication concentration. What's the formula to figure out how many capsules are needed for a prescription? We know the prescribed dose and the total number of pills in the bottle. A. Total quantity divided by dose per capsule. B. Dose per capsule divided by total quantity. C. Total quantity multiplied by dose per capsule. D. Dose per capsule minus total quantity. The correct answer is A. Less than break time equals 1s greater than. To find the number of capsules needed, divide the total quantity by the prescribed dosage per capsule. A patient needs 300 milligrams of medication. The vial has 600 milligrams in 2 milliliters. How many milliliters should be given? A. 1 milliliter. B. 1.5 milliliters. C. 2 milliliters. D. 3 milliliters. The correct answer is B. To calculate, 300 milligrams divided by 600 milligrams multiplied by 2 milliliters equals 1.5 milliliters. How do we figure out how long a medication will last? We know the amount given and how many doses are taken each day. Option A. Amount given times doses. Option B. Amount given divided by doses. Option C. Doses divided by amount given. Option D. Amount given times doses times 24 hours. The correct answer is B. The formula is quantity dispensed divided by number of doses to calculate the duration of a medication. What is the formula to calculate the weight of a substance, given its volume and density? A. Volume times density. B. Volume divided by density. C. Density times volume times 1000. D. Density divided by volume. The correct answer is A. The formula is volume times density to calculate the weight of a substance required. A patient is prescribed 800 milligrams of medication. The vial contains 200 milligrams per milliliter. How many milliliters should be administered? A. 3 milliliters. B. 4 milliliters. C. 3.5 milliliters. D. 4.5 milliliters. The correct answer is A. To calculate, 800 milligrams divided by 200 milligrams per milliliter equals 4 milliliters. What's the formula to calculate IV infusion flow rate in drops, given the tubing factor, volume, and time? A. Tubing factor times volume, divided by time. B. Volume times time, divided by the tubing factor. C. Time divided by volume, times the tubing factor. D. Tubing factor divided by volume, times time. The correct answer is A. The formula is tubing factor times volume to be infused, divided by time in minutes, to calculate the IV infusion flow rate in drops. A patient needs 1000 milliliters of solution infused over 8 hours. What's the flow rate in milliliters? A. 80 milliliters. B. 125 milliliters. C. 150 milliliters. D. 200 milliliters. The correct answer is A. To calculate, 1000 milliliters divided by 8 hours equals 125 milliliters. What's the formula for calculating the diluted concentration of a solution after dilution, if you know the initial concentration and dilution factor? A. Initial concentration times dilution factor. B. Initial concentration plus dilution factor. C. Initial concentration divided by dilution factor. D. Dilution factor divided by initial concentration. The correct answer is C. The formula is initial concentration divided by dilution factor to calculate the diluted concentration of a solution after dilution. A patient needs 90 milligrams of medication. The vial contains 30 milligrams per milliliter. How many milliliters should be administered? A. 2 milliliters. B. 3 milliliters. C. 4 milliliters. D. 5 milliliters. The correct answer is B. To calculate the volume needed, divide the required dose, 90 milligrams, by the concentration of the vial, 30 milligrams per milliliter. 90 milligrams divided by 30 milligrams per milliliter equals 3 milliliters. What's the formula for calculating the diluted concentration of a solution after dilution, knowing the initial concentration and dilution factor? A. Concentration after dilution equals initial concentration times dilution factor. B. Concentration after dilution equals initial concentration divided by dilution factor. C. Concentration after dilution equals dilution factor divided by initial concentration. D. Concentration after dilution equals initial concentration plus dilution factor. The correct answer is B. The correct formula is concentration after dilution equals initial concentration divided by dilution factor. Concentration after dilution is the resulting concentration after dilution. Initial concentration is the original concentration of the solution. Dilution factor is the factor by which the solution is diluted. What's the formula to figure out how many capsules are needed for a prescription? We know the prescribed dose and the total number of capsules in the bottle. A. Number of capsules equals total quantity divided by dose per capsule. B. Number of capsules equals dose per capsule divided by total quantity. C. Number of capsules equals total quantity times dose per capsule. D. Number of capsules equals dose per capsule minus total quantity. The correct answer is A. To determine the number of capsules needed, Divide the total quantity by the dosage per capsule. Number of capsules equals total quantity divided by dosage per capsule. What is the formula to calculate the amount of drug in a compounded medication based on its concentration in total volume? A. Amount in milligrams equals concentration percentage times volume in milliliters, all divided by 100. B. Amount in milligrams equals concentration percentage divided by volume in milliliters, all multiplied by 100. C. Amount in milligrams equals concentration percentage plus volume in milliliters. D. Amount in milligrams equals concentration percentage minus volume in milliliters. The correct answer is A. Amount in milligrams equals concentration percentage times volume in milliliters, all divided by 100. How many milliliters are in 1 cubic centimeter? A. 0.1 milliliters. B. 1 milliliter. C. 10 milliliters. D. 100 milliliters. The correct answer is B. 1 cubic centimeter is equivalent to 1 milliliter. What is the formula to calculate the total quantity of a drug product if the concentration and total weight are known? A. Total quantity equals weight in milligrams divided by concentration percentage. B. Total quantity equals weight in milligrams multiplied by concentration percentage. C. Total quantity equals weight in milligrams plus concentration percentage. D. Total quantity equals weight in milligrams minus concentration percentage. The correct answer is B. Total quantity equals weight in milligrams times concentration percentage. A patient needs 400 milligrams of medicine. The vial has 200 milligrams per milliliter. How many milliliters should be given? A. 0.5 milliliters. B. 1 milliliter. C. 2 milliliters. D. 3 milliliters. The correct answer is B. To administer 400 milligrams with a concentration of 200 milligrams per milliliter, the patient needs 2 milliliters. That's 400 milligrams divided by 200 milligrams per milliliter. What's the formula to figure out how many doses to give, knowing the total amount and the amount per dose? Number of doses equals total quantity divided by dose per administration. Number of doses equals total quantity times dose per administration. Number of doses equals total quantity plus dose per administration. Number of doses equals total quantity minus dose per administration. The correct answer is A. The formula to calculate the number of doses is number of doses equals total quantity divided by dose per administration. How many milliliters are in 1 milliliter? A. 0.5 milliliters. B. 1 milliliter. C. 1.5 milliliters. D. 2 milliliters. The correct answer is B. There is 1 milliliter in 1 milliliter. What's the formula to figure out how long a medication lasts if you divide the amount given by the number of doses? Option A. Duration equals quantity times doses. Option B. Duration equals quantity divided by doses. Option C. Duration equals quantity plus doses. Option D. Duration equals quantity minus doses. The correct answer is B. The formula to calculate how long a medication lasts is duration of time equals quantity dispensed divided by doses. A patient needs 120 milligrams of medication. The vial contains 40 milligrams per milliliter. How many milliliters should be administered? A. 2 milliliters. B. 3 milliliters. C. 4 milliliters. D. 5 milliliters. The correct answer is B. To administer 120 milligrams with a concentration of 40 milligrams per milliliter, the patient needs 3 milliliters. That's 120 milligrams divided by 40 milligrams per milliliter. How many milliliters are in 1 quart? A. 1000 milliliters. B. 250 milliliters. C. 100 milliliters. D. 2000 milliliters. The correct answer is C. There are 1000 milliliters in 1 quart. What is the correct formula to calculate the solute to solvent ratio for preparing a dilution? A. Solute to solvent equals initial concentration to final concentration. B. Solute to solvent equals final volume to initial volume. C. Solute to solvent equals final concentration to initial concentration. D. Solute to solvent equals final weight to initial weight. The correct answer is A. The correct formula to calculate the ratio of solute to solvent for preparing a dilution is solute to solvent equals initial concentration to final concentration.